The number one misconception, and this has, again, been very consistent ever since we started Clear, and I know the team starting members, they had the same sort of feedback from the market, which is we get the comment all the time, why would I provide discounts to my cash pay patients when they come in and pay full price? That's the number one objection. And I can tell you, I can sort of go after, sort of address that one in multiple paths. So on one side, we look at data. So we're integrated with a lot of practice management systems, and we see the data in these offices. And here's the stat that most people don't understand is those cash pay patients, you are already providing a discount to them. So on average, the offices provide about a 14% discount to those patients. And it's like day of treatment discount. Yeah. So they're in the chair, they need treatment. They're not, the office wants to give them a bit of savings, so they offer them 10%, 15%, 20%. Well, the average of that is 14%. Yeah. Right. And so you're already providing a discount. The second thing to understand is those patients just don't come in very often. So on average, if you looked at the total, yeah, exactly. Yeah, they'll come in when they need treatment, right? When they're in pain. And you look at the averages across the offices that we serve is, if you look at total uninsured patient base across an office, they come in on average a half a time a year. So one time every 2 years. That's the average. And so obviously they're just not getting treatment, right? And I sort of mentioned this in the beginning. Why is that? Well, the reason they're not getting treatment is they're worried about the cost. They don't have coverage. And so they just stay away. Yeah. And by the way, this isn't just in dental. This is across all healthcare. Yeah. And so they come back to the original question. So they say, why should I provide a discount, right? Well, those patients aren't coming in. They aren't accepting treatment. So if you can give them some type of savings, right, and give them a subscription that's packaged up with their preventive care included, they're going to come in. And we see that day in and day out. They come in regularly, they accept treatment.